Hey guys, welcome back to our YouTube channel. We're going to be talking about artificial insemination. We got Miley and Joey's going to start us off.
So, artificial insemination is the deliberate introduction of sperm into the cervix or uterine cavity to achieve pregnancy through in vitro fertilization by means other than sexual intercourse. And there's three types of artificial insemination. There's intrauterine, intratubal, and intracervical. And pretty much all that means is at which point the sperm is ejected. It's a relatively short and painless procedure. Many women describe it similar to a pap smear. You can experience cramping and light bleeding after, and the doctor will probably have you lay down for 15 to 45 minutes to allow the sperm a chance to work. It's done for couples who have donor sperm, unexplained infertility, endometriosis-related infertility, male infertility, cervical infertility, or semen allergies. And risks of the procedure include infection, spotting, and multiple pregnancies.
So now we're going to talk about the ethical dilemma. So according to the AMA Council of Ethical and Judicial Affairs, all fertilized ova not utilized for implantation and that are maintained for research purposes shall be handled with the strictest adherence to the principle of medical ethics, to the guidelines for research and medical practice expressed in the Council's opinion on fetal research, and to the highest standards of medical practice. So in vitro fertilization enables couples to conceive and bear a child. It can also be useful for genetic researchers who are looking to prevent the transmission and treat genetic defects. However, the concern is that physicians and researchers might use the extra eggs and sperm for other projects besides the purpose given by the parents. So the rules that we want them to follow, we want fertility laboratories to participate in credible professional accreditation programs and comply with ethical standards and assisted reproductive technology. And then patients must always be aware of all aspects of assisted reproductive technology, and they must have signed conformed consent.
So I'm going to be talking about the pros and cons, and to start off with the pros, it's a remedy for male infertility, it's a solution for low sperm count, it's affordable and safer than some other treatments, it's a solution for cervical issues, and a relief from a sperm allergy. So this is a pretty rare condition, but it can happen, so this can be a method to work with that. So for cons, it takes more time than natural intercourse, so it takes around 6 months for the woman to become pregnant. For most women, hormonal drugs are used for ovarian stimulation, so this can cause hormonal imbalances. It can result in infection and vaginal bleeding. Not all the time, but because of the use of the catheter, that can be a risk. If they have multiple pregnancies, so multiple babies, this can lead to preterm labor. And it's not always guaranteed that the egg can turn out to be a healthy embryo, but this isn't always the case. It's just a small risk. So in conclusion, this has become a leading solution for many families who are willing to conceive a baby. The process for many is worth trying for their happiness because the advantages usually outweigh the negatives. Thanks for watching.